This video vignette is on how to treat your own arthritis. Now, if you're going to treat your own arthritis, I assume that you've already seen my video on how to figure out what is wrong, and that you've also seen my video vignette on what arthritis is, and I assume that you've decided that you have arthritis. And you're probably right, but even if you're not right, the following treatments we're going to talk about are probably going to help and probably will not hurt. For this video, I borrowed heavily from the guidelines published by the American Academy of Orthopedic Surgeons on the treatment of arthritis. These are treatments that you don't even have to see a doctor for. You can do these things yourself. So there's a bunch of different things you can do. You can use pain medications. Pain medications that you can buy over the counter include things like acetaminophen or Aleve or Advil. Aleve and Advil are non-steroidal anti-inflammatory drugs. They're wonderful, but they do have a few side effects, such as gastric irritation. Probably the one that has the least side effects is acetaminophen. It's a pain medication as well, but it's not an anti-inflammatory medication. If you're going to use acetaminophen, which is also called Tylenol, I would recommend the 500 milligram tablets, which are the extra strength tablets, and I would recommend that you take 2 tablets at a time and no more often than every 4 hours apart, and don't take it any more than 3 times a day. It's a wonderful medication, very safe. It's effective in treating the pain in 70% of people, but the most common cause of liver failure in the United States is overdosage on acetaminophen. The reason for that is because many prescription medications also contain acetaminophen, so make sure you don't get over a total of 3,000 milligrams of acetaminophen per day. Then you can use anti-inflammatory medications such as Aleve or Advil. There are many prescription anti-inflammatory medications, but you can get these over the counter. Aleve is naproxen, and Advil is ibuprofen. And then the other thing that you can get over the counter without a prescription is medical liniments such as Bengay, capsaicin cream, Blue Emu, things like that. Exercise such as walking, cycling, swimming, Tai Chi, yoga. The way that exercise works is, if you think about it, it's kind of counterintuitive, because you'd really think that the more you exercise, or exercise would cause the cartilage to wear away quicker, and you're right. If you overdo it, it will. But gentle, low-impact exercises in modest amounts has actually been shown to decrease pain associated with arthritis, and there's been a lot of studies looking at this. Now, how does it work? Nobody really knows for sure, but the thought is that every tissue in your body gets its nutrition from blood being pumped to it from the heart, like your muscles, your tendons, your bones. Everything gets blood pumped to it, except for one tissue. Do you know what that tissue is? Haha, you guessed it, that's right, cartilage. Cartilage, wearing away the cartilage is what causes arthritis. And cartilage gets its nutrition from synovial fluid, the fluid inside the joint. That synovial fluid is pumped to the cartilage by exercise. And that's probably how exercise works, among many other ways. Nutritional supplements such as glucosamine and chondroitin sulfate have been shown to be effective for decreasing pain associated with arthritis. Now, interestingly, the American Academy of Orthopedic Surgeons does not recommend the use of glucosamine and chondroitin sulfate because of the GATE study, which was published in the New England Journal of Medicine in 2006, which showed that glucosamine and chondroitin sulfate were no more effective than placebo. However, this is controversial because many studies, many of them published in a journal called Osteoarthritis and Cartilage, have shown that it is effective. And what's really fascinating is that some studies, such as the study that's published in Lancet, a prestigious English medical journal, has shown that it slows down the loss of cartilage. It may actually be a disease-modifying agent, and that's exciting because we don't have anything right now that can slow down the loss of cartilage. I know you've seen ads on TV that said this or that will regrow your cartilage. Forget about it. Nothing can regrow your cartilage once it's gone. But that study in Lancet showed that this was a 3-year study in humans in the knee, and it showed that it actually halted the progressive loss of cartilage in the knee. The only bad thing about this stuff is that it takes a long time to work. It's not like a pain pill. It's not like you take it and then half an hour later you have less pain, because it doesn't work by getting rid of pain. It works by strengthening the cartilage, because glucosamine and chondroitin sulfate is just simply the building blocks for the chemicals that cartilage is made out of. And so the first study that was published in the United States on glucosamine and chondroitin sulfate in a journal called Osteoarthritis and Cartilage in 2000 showed that it takes 4 months to reach full effect. When you really have, sometimes after you exercise too much or just have a bad day at work and you come home and your knee is killing you, or you get on that bicycle and your hip is hurting, what can you do to knock out that pain that's really severe that happens once or twice a month? Well, heat or ice. Now, do you know which one most people find effective? The answer is ice. And the way to use ice is just simple. You take a baggie, fill it full of ice cubes, and put right on the area where it hurts, say your hip, and leave it on there for about 15 minutes and then take it off, and that'll knock that pain out, and you may not have to use it again for another month or two. Use of a brace, such as an elastic. There's 2 types of braces. There's an elastic brace and an unloader brace. And you can get an elastic brace from any pharmacy. An unloader brace is a prescription thing. So we're not going to talk about that here, because we're only talking about things you can do yourself to treat your own arthritis here. Another thing that you can use is a cane, or what I particularly like is if you're walking for exercise, especially trekking poles. Now, trekking poles are cool for a couple of reasons. If you're using a trekking pole, people who exercise and want to get a good cardiovascular workout use trekking poles, so you don't look like a little old lady if you're carrying trekking poles like you might if you were a cane. The other thing that's nice about trekking poles, especially for arthritis of the hip, is that they greatly decrease the joint reactive force. That is, the force on the hip every time you take a step, which, if you don't have something to support your weight, is about 3 1/4 times your body weight, believe it or not, every time you take a step. And those trekking poles or a cane can greatly decrease that. So these are some things that you can get going on right now, this second, to help decrease your pain. Congratulations, you're on your way to getting rid of your pain.